For those of you who haven't been here for the last 3 days, I'm Cynthia Kimmelman DeVries. I'm a policy analyst here at the Council of State Government's Justice Center. I am also a TA coordinator to a number of juvenile and adult grantees that have received funding under the Justice and Mental Health Collaboration Program. And if you're in this room, you are interested in funding and sustaining your mental health and or criminal justice collaboration under the Justice and Mental Health Program. And I am here with Dan Abreu. I'm a fan. Dan is an associate director of SAMHSA Gain Center, and I'll let Dan introduce himself.
So, associate director since 2005 of the Gain. People know what the Gain Center is by now? Okay, great. And Hank Stedman's our president. And prior to coming to the Gain Center, I oversaw reentry for people coming out of state prisons, people with mental illness coming out of state prisons and returning to the community. So I've had some direct program experience and also some experience with sustainability. And certainly with the Gain Center, we oversee, since 2002, over 50 jail diversion grantees that SAMHSA provides funding for. And 75% of our programs are sustained. Those programs are sustained. So we do a lot of work on sustainability with our own grantees. So in preparing for this presentation, I hadn't worked with Cynthia before, but we discovered we both have a love of movies. And also, and we were both just enthralled with the Oscars. And so we know it's the end of the day. I mean, it's the end of the conference. Everybody's been sitting, and so we thought that we'd look for something inspirational from the movies to get you started. No, can't do it. Okay,
you could verbalize it. He was very good acting with it the other day.
What you would have seen was the scene where Jerry Maguire is talking to Cuba Gooding. And the "Show Me the Money" skit, the dancing and the bouncing, and "Show me the money, Jerry, show me the money, Jerry." And the point of that scene would have been that this is not necessarily a "show me the money" presentation, and I know that will disappoint you. This is how to get to the money, possibly. You guys are not Cuba Gooding waiting for Cynthia and I to work the money for you. It's really, you guys are more Jerry Maguire. You guys are going to be the agents doing the marketing, doing the relationship building, because if you remember in the movie, Jerry couldn't get going until he got his relationship straight. And it's really about what money is about generally. Until you get relationships straight, money's not going to come to you. And that's what this is going to be about. Now, from here, I'll turn that over to Cynthia.
Yeah, I'm sorry. When I did this presentation before and I go to this slide, you'll see that the funding opportunities part is all the way at the bottom. So you have to stick through all of it to get to the all of 2 out of 59 slides that you guys are all very interested in. Okay, so here's what we're going to do. I'm going to tell you really, really briefly about the Justice Center. If you're a fiscal year 2011, this might be a refresher. If you're 2012, go to sleep on that slide. We're going to talk a little bit about the program capacity for sustainability, so basically the components of your program that you want to have funded. Because I'm guessing that you guys may not have actually thought about the things like those hard choices of which things you do and don't want to fund. We're going to talk a little bit about building collaborations and why that's important to sustaining your programs overall. Demonstrated outcomes we're not going to actually talk about. We're going to speed through that because you actually just sat through a plenary that talked about that. That's essentially all about data. We will get to the 3 or 4 slides that you guys actually want to see, which is the list of the agencies that give away money. And then we're going to talk a little bit about what you do long term in terms of marketing strategies with your grants. So about the Justice Center. We are a national nonprofit, nonpartisan membership organization that serves all branches of government. We also do a lot of research, technical assistance, evaluation work for local, state, and national the federal government. So we partner on a lot of other projects in addition to the technical assistance work that we do. For those of you that are familiar with the mental health piece, that's me and the relationship that you all have with us. That's under our mental health project called the Consensus Project. And then we also have a piece or arm that's all reentry work called the National Reentry Resource Center that was put together through the Second Chance Act grants. You'll hear about those a little bit later in that funding opportunities section. And then we also have a large federal initiative we partner with a number of states called Justice Reinvestment. All 3 of those, there are websites for all 3 of those things, and just for a heads up for everybody, we're actually going to be redoing our website shortly, and all of that stuff is going to be under one umbrella on our website. So specifically about the Justice Center, if you are not familiar with some of our products, in 2002 we wrote this landmark consensus project report that is a list of policy recommendations, over 50 of them, that we partnered with different criminal justice and mental health partners across the country. It's a really nice practical logistics, actual tools and ideas for you guys to implement along different continuums in this report. It's free and downloadable on our website, as are all of the rest of the products that I'm going to list here. We provide TA to states. You guys are pretty familiar with that by now. We have a whole suite of different publications. We have an information sharing publication. We also have a publication called Breaking School Rules, which is all about the school to prison pipeline. We have a suite of publications about law enforcement, community corrections, and if you Google mental health courts, if you were a court partner in this room, you will appreciate it. The first 10 things that come up that are on mental health courts when you Google are all CSG publications. And most recently, and I want to highlight this specifically, we just launched in January or December our new online curriculum for mental health courts. A lot of what we are going to go through today and some of the slides are from this curriculum. It is free, it is online, it has a bunch of different modules that are self-paced. That you can use with your teams to talk through things like building collaborations, marketing your program. There's a Mental Health 101, CJ 101 trainings on there. There's worksheets. There's things for you to take back with your partners to go through, in addition to a funding section. A lot of the stuff in that module is in this presentation today. We do a monthly webinar series. We also have a newsletter that goes out to about 10,000 people every month, both on the mental health side and on the reentry side. You can sign up for both of those newsletters on our fund page. Our webinars are announced through that. So we have a host of different webinars on mental health topics, on reentry topics, on general criminal justice across the board. They're all archivable and free on our website. So after you view them, if you can't actually watch them when they're live, you can listen to them afterwards. Okay, so these 3 resources are the 3 things that are what I give to my jurisdictions when I am working with them. I know they're going to look a little funny because a lot of them are talking about juvenile justice, and juvenile justice. Don't be fooled. Just because it's a juvenile justice geared document doesn't necessarily mean it's not appropriate for adult programs. Okay, so the first one, you'll see a lot of quotes from that one across the board. There's a framework that's in that model, the Systems of Care Programs document that's actually put together by Kathy Squira and Joe Kokoza, who are also with Policy Research Associates, who oversees the GAIN Center. It's a great document that provides you with specific grant programs like the slides you'll see in that funding section that you're interested in later on. So it's got a lot of stuff in addition to what I'm going to present to you. The second document I really like. It not only provides a framework similar to the first one on how you look at funding and sustainability, but gives you a whole lot more different tactical strategies. And gives you a lot of examples from around the country of how different jurisdictions leveraged funding in their communities for very specific mental health, criminal justice collaborations. While those things might not fit your programs exactly or perfectly, I know that I've been able to use it with jurisdictions that I've worked with kind of to brainstorm around how you would leverage resources like this in your community. And the last one, building sustainable organizations, you're going to see a couple of things throughout the presentation that I've pulled from there. Specifically, what they have are some worksheets that are really nice for your team to use when you're talking through building sustainable organizations and the components of your program. Okay, so capacity, what does that mean? So, you need to figure out if all the components of the program that you actually are running right now are ones that you want to sustain in the future. So I'm just curious, has anybody in the room had those hard conversations about how many case managers do you actually want to keep if all of your funding for your $250,000, your $200,000 goes away? Like, have you actually sat down as the leadership of your group and said, well, if we had to cut all this money, who can we get rid of? And I hate to put it in those terms, but who can we keep? And if we had to not keep some of our case managers or some of our clinical staff, how do we want to change the components that we do with our supervision and those kinds of things? Do we have peers that are in our program? Do we provide transportation and Metro cards? Do we provide meals to people? Are we keeping our offices open after a certain hour? All of those kinds of things. And I'm going to bet you that you really haven't sat through and really looked at every single component of your program when you're thinking about your grant and decided which are the things that you can really do with and which are the things you can do without, which I know are really, really hard things. Because I know that everybody in the room really just wants me to tell you that there's going to be money for you to sustain all of the pieces, and that's not the world we live in. So I'm sorry to be really disappointing. And the reason that I'm emphasizing that is because there are going to be aspects of your program that are actually, and this is very frank, more worthy to be sustained than not. Basically, the bullet points that are on your slide are basically what we're going to talk through today, more specifically looking at things like the goal and the mission of your program, improving getting your key stakeholders on the table, improving your collaborations, using data, and how you use that, marketing your program, and identifying different funding streams. If you didn't know already, and I don't know for those of you who your TA coordinator is, I know that some of the people in the room belong to me, and I emphasize this and overemphasize this and emphasize this again. In 2010, for JMHCP, that was the highest funded year. There were 62 grants that were awarded. The funding was $12.6 million. In 2011, the funding was $9.9 million, so we couldn't fund 62 programs, or not we, BJA couldn't fund 62 programs, so that dropped to 40. And of that 62, there was a range: planning and implementation expansion grants. And, planning likes to apply for the next category of funding, planning and implementation. P&I likes to apply for expansion. Of the 62 grants, probably about half of them applied for the next category of funding. That many were awarded in 2011. 2 more were awarded in 2012 because 2012 was not a competitive year. They pulled from the people that applied. There were 237 applications for JMHCP last year, and 36 of them were funded, and it's got an acceptance rate of 23% historically over time. So if you are relying on federal funding and this type to sustain your programs, it's not a really good outlook, and it's not a really good plan. And while I love all of the people that are in the room, and I really all want you to be funded, and we have absolutely nothing to do with that funding, and if in a perfect world I'd be Empress and there would be millions of dollars for this work, it's not realistic. Okay, so moving on to what I was just basically talking about in terms of the program capacity for sustainability. It's not good enough when you are meeting in your collaborations and talking about these pieces and talking about your program to just be meeting about your jurisdiction as a whole. You need to be meeting about your program, this specific program. So it's just because you have other initiatives that are going on in your jurisdiction and you might have other grants. You also need to talk about this grant because there are things that you've layered on to your program for this grant that you also need to decide whether or not you want to keep. And it's okay for you to decide that you got this JMHCP grant and that you don't want to keep components of it. That's not a horrible thing. It's sad and it's not good, and we want to serve all the target population that you identified and use all the evidence-based practices, but it's quite possible that you can't. And when you're talking about your mission and your goals, you have to look towards that, and it's a good exercise to actually decide what your overall mission and goals are and how to stick to that. So I'm going to speed through these pretty quickly. What are your costs? And here are some of those questions specifically. Do you need new staff, or you're assigning people to other responsibilities? And in the light of any kind of budget cuts, can you do that? Can other case managers have a dedicated mental health caseload, for example, or a dedicated substance abuse caseload? Clients that have specific needs, so you're building that capacity internally. As far as treatment, what will be covered by insurance benefits? Can Medicaid pick up any things that are actually being billable? We're going to talk in a little bit, Dan will, about ACA and how that's going to impact a lot of the clients that we serve. And then in terms of facilities, what do you actually need? Have you guys looked at your facilities, how much you're spending on computers, databases, office space? Can anything be combined with other program partners that are in your jurisdiction? I know that I'm going to speed through these really quickly, just an FYI for you guys. It's a lot of slides. It's the reason that we didn't copy them and hand out. These are going to be available on our website in a couple of weeks when we post all of the presentations to the website.
So this isn't on the jump drive?
This is not on the jump drive. Okay, so that building sustainable organizations, it was the third bullet point on that list of things that were my go-to. This is a worksheet, or one of them that's in there, that asks the kinds of questions that are those hard questions to ask. Keep what in existence for how many months or years? Help blank endure for how many months or years? And so on and so forth. And I have to tell you that having been in a program and run a program before and worked with my colleagues and tried to figure out that, oh my God, we have to let case managers go, and what does that look like? I don't think that we ever framed it in these terms, and we never thought about it long term in this way, especially not in the months or years way, and how long, if we're building capacity around our staff, how long in reality you would need to keep somebody. If you have a benefits person, then that's all they're doing, and they're coordinating a lot of benefits. Can you roll that person into other positions when those other positions get trained and learned about that function? And I don't mean adding on too much work to somebody, but a natural progression of certain responsibilities, what can actually be taken on in other places. The other thing to know, and if you are fiscal year 2011, less relevant to you, fiscal year 12, more relevant, but in terms of these programs in general, the other thing, this is going to lead to what we talk about in terms of data and talks about your stakeholders and how you market your programs. You have to look at your programs as an experiment and that you're starting off small, and a lot of the programs under JMHCP haven't done a lot of rigorous data collection to know who your actual target population is on the ground and how your evidence-based practice is actually going to work with the people that you're working with, what your outcomes are going to look like. So a lot of times what I tell jurisdictions is this is your practice program. So you're spending your first 6 months, 8 months planning, you're doing your implementation, and at the end of this specific grant, you're figuring out, did this work? And what we want to encourage you is to keep the numbers small. And there's not, under JMHCP, I think, any target populations that are particularly very big. I think they're pretty small, and I think everybody's pretty good at doing this here. And remember, this isn't just for here. This is for any programs that you're working with in general. You want to figure out what works in practice and not just on paper. And a lot of the programs are what works on paper. And it's okay to realize, you know what, and this has happened a lot of times with the programs I've worked with, we get into the implementation stage, they have amazing planning, we get into implementation stage and we go, oh my God, we don't have enough girls. Or we thought there were going to be a lot of girls, and we thought there were going to be a lot of girls who had trauma, and there just aren't. Or we thought that there would be a lot of women who were going to be cycling through the system, and there aren't. Or we thought that there were going to be a lot of boys who needed trauma intervention, and there aren't. And we trained our staff and did all this stuff on this trauma intervention, and we have like 3 kids, or we have 6 adults. So you need to figure out, remember, this is sort of like a practice.
So it's true that very often it's sustainability. You may not, as your program moves on, be able to keep the same level of services, or else they'll morph a little bit into some other program. But I would also encourage you to think big when you're thinking about sustainability. So in most communities, when they're looking at criminal justice and mental health issues, I mean, these criminal justice mental health issues span the criminal justice system, right from police to prison and jail reentry and probation. Right? It spans the system. And in a lot of communities, the response to the different issues across the system are fragmented. A police commissioner will get mad about something and want to get a program started, and that'll start here. And then maybe there'll be a reentry program over here, or maybe probation will do a specialized caseload. But these programs aren't necessarily talking to each other, and communities really haven't looked strategically at where their specific diversion program fits and the overall scope of things, how one relates to the other and how one can help the other. Hence the sequential intercept model. Everybody familiar with the sequential intercept model?
Raise your hand if you're not.
Raise your hand if you're not. So a minute on the sequential intercept model. The nice thing about the criminal justice system is that it's organized in a fairly direct way. People get arrested, law enforcement, they're arraigned in a court generally within 24 hours. There's, if people aren't released, and they go into jails and disposition courts, including veterans courts, DV courts, mental health courts, drug courts. If there's a sentence, then they're going to do prison or jail time. And coming out on reentry, many will go on to probation and parole. Each one of these intercepts is an opportunity for the mental health system to engage somebody as they're going through it and divert them out of the system or reduce penetration into the system. So in this intercept, you have mobile crisis teams and police crisis intervention teams. Intercept 2 arraignment is, at that very, very first court appearance. It's very difficult to do because it's hard. So many people are going through at that point in time that it's hard to screen and get them and to get them out. But it can be done. There's some very good programs here. Intercept 3 is probably the best understood diversion. It's mental health courts, veterans courts. People get that. And that's where a lot of diversion activity takes place because these aren't understood that well. Reentry from jail and prison, again, another intercept point where people can get into programs. And on the Intercept 5, community probation and parole, people with mental illness are more likely to violate probation or parole than people without mental illness. So it's another intercept point where instead of violating them, you come up with a behavioral health intervention. So that's the model, right? And so communities using this are able to plan more strategically to identify people and get them into services. So we did some work with cases actually over the past 2 years, and they started a diversion program in Manhattan Criminal Court at arraignment. So in New York City, you get arrested. There's 24 hours where you're held in a detention center, and then you're in court, and there are hundreds of people streaming through. Now they thought that it would be easy to identify people, identify their categories of the people that they want, the legal categories of the people they wanted to divert, and get them out into their program. They had a hard time finding people because the arraignment court meets it's 2 shifts. There's a morning shift, a day shift, and an evening shift, and right through the weekend. But they were going through so fast they couldn't stop the process to identify them. And so they got grant funding to convene a stakeholder group to help them figure out what to do here. And they hired PRA, it was Hank Stedman and myself, to come down and kind of help them work through the process. Can you hit the next slide? So what we did is we started to look at the system and how the system related to the program. And we mapped it out for them. You know, what happens at police? Where do they go? What are the crisis services available? Why do the police bring people here instead of here? We looked at the booking process and the opportunities to do screening before they got to the arraignment court process. And so we found that there were a lot of resources that they really hadn't been aware of and they hadn't been utilizing. And legal aid was a very important partner with cases on this program because they were doing the defense work. And so next slide. So what really came out of this, and one more slide. And what came out of this mapping that we did is, for a lot of reasons which I won't go into, they decided legal aid was going to do the screening for the transition case management program. Because they were the ones that were seeing the person first. They could ask the mental health questions, 3 or 4 questions, and say, this is a good case, and because legal aid wants to protect rights, and the client wants to do it, and I think it's in his legal interest. So we thought these were the guys that would take hold. They did. They were so jazzed about it, they went and got grant funding to get a social worker to help with the screening and do a complementary diversion program to cases. So this is thinking big, right? This was just, how are we going to get our little program going? Now they've got another diversion program attached to this, and now what's happened is there's a lot of, because of the stakeholder group included stakeholders from all these different areas and all these different programs. Can I have the next slide? Things have started to change. So instead of a transitional case management stakeholder group, at one point, because there was a mental health court that was being developed, because there was another pre-trial diversion program that was being developed, And they wanted to do more, and once people got to Rikers, it then became the New York County Criminal Court Mental Health Diversion Work Group. And at that point, the leadership of the work group changed, and the Assistant Commissioner for Mental Hygiene became co-chair of the committee. And so then ACA came, right? And so we started asking questions about, well, what's the New York State doing around the Affordable Care Act? And so this committee changed their name again, and now they're the New York County Behavioral Health Diversion Forum. And they've got citywide impact now and influencing state policies around criminal justice populations. So, what happens is with your stakeholder groups is pay attention to what's going on around you and be broad in your focus. And often what you'll find is that your mission changes, your leadership changes, and your memberships may change as your initiatives grow. In our JDTR, in our jail diversion programs that we provide technical assistance to for SAMHSA, a lot of these programs started small with the pilot, but then they became a catalyst for diversion across their system. They ended up getting, their sustainability became getting linked to a mayor's task force on criminal justice reform. And not only did their program got funded, several programs and initiatives got funded because people saw the wisdom of this. In Nebraska, they organized a statewide conference on diversion. So that then the diversion issue became at the state level. So this can have the programs that you are operating, and we'll talk about marketing and some of those other things. And as Anne Marie said, you are special. You're a small group of applicants in the country that got these programs. Use that specialness and market these programs. And so we'll talk more about those issues in a minute.
I really like Dan's example of New York because I think that we start by saying, or I just said to you guys to do pilot programs and start small. And I think that this is a great example to illustrate how you start small and figure out what actually works in practice and not just on paper. And then once you figure that out, that you have this like core thing that is actually a really good gem, then you can actually use that to start leveraging and showing your community stakeholders what's important and special about your programs. Okay, so your stakeholders. You'll have heard this if you are one of my grantees. You'll have heard me beat a dead horse around this. You probably want to shoot me at this point by talking about collaboration, 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 collaboration. I'm the broken record, Cynthia. Let's see. This is my third cohort of grantees. I have worked with 52 programs, I think, now around the country. I've been keeping track. And I can divide you guys up into programs that have really strong stakeholder collaborations for a long time, and then ones that don't. And the ones that have stakeholder collaboration for a long time, this is all anecdotal Cynthia data, have a lot of different kinds of blended and braided funding and connections with a lot of different community leaders. So they have maybe a county level criminal justice board or criminal justice mental health group or something like that. And they usually have a couple of judges that are very good champions. And they have been able to leverage a lot of different kinds of diverse funding. So that's my long way of saying, you really need to get the key stakeholders in your organizations on board, not just your judges and your politicians, but the executive directors of your organizations who also know people. But don't believe me, because you don't believe me. Because I don't believe me either. And I know that you don't believe me, so that's okay. On SAMHSA's website, on the Gaines Center, there's a section on juvenile mental health courts. And it's a map. And there might be more, but as of last year, there were 41 of them that were listed. And with that map, there's an article that Lisa Callahan from the Gaines Center wrote. They did a survey of all the juvenile mental health courts across the country, all 41 of them. And every single one of them, without exception, was started by a judge or a politician, and that's how they have maintained their funding. So if you don't think it's important to keep those people in your back pocket and connected to your program and emotionally invested in your program and knowing about your program and knowing about your clients, you're wrong. Okay, so it's just my 2 cents. I could not be right. I mean, okay. So here, more points about cross-system collaboration. Are the relevant treatment and justice agencies involved with the collaborating program? Do you have formal interagency agreements that are in place? I'll get to that in 1 second. Are your collaborators adequately involved in your program design? And the way to get them emotionally invested is by getting them to the table, to your meetings, to be a decision maker at your meetings. It's not okay, and I mentioned this before, for you to have a stakeholder collaboration in your jurisdiction that talks about your SCA grant, or talks about your JDTR grant, or talks about your JDAI grant, or talks about anything else that is in your community. You need people to get together to be emotionally invested in this program. And I've had jurisdictions that say to me, you know, it's never occurred to me that we should actually meet about this program, because the components of this program are different. And what you're trying to do here is different, and that's how you get people to be invested in your program, by letting them know what's different and what's special and what's important. And we'll talk about that in marketing. I have a really nice quote from someone later on that talks about the hard work that this involves. Let's see. Okay. So MOUs. I'm sure people in the room have never, ever heard these statements. I'm quoting from programs I've worked with. But I never said I'd come to a meeting once a month for an hour. Are you kidding me? I can't do that. I'm sorry. I'm traveling. I'm busy. No, I never said I'd do that. Or referral form. We never agreed to fill out a referral form. In corrections, now, do you know, I'm sorry, my corrections staff cannot fill out another form. Screening instrument? No, we don't have the staffing capacity to do that. I'm sorry, screening? No, I know it's an additional 3 minutes, but we have them do 4 other forms that take 3 minutes, and I'm sorry, they're really overburdened. Or, no, we don't have anybody with background on the staff that does that. I don't know why you think we do. No, we never told you we'd do that in the beginning. Mental health in our substance abuse facility? I mean, sort of we do that, but no, not like what you're expecting us to do. So I'm sure that none of you have ever heard any of that. And essentially, it's really important for you to establish MOUs. And why is this part of funding and sustainability? Because you want to have good collaboration and communication with the programs that you're working with, because you want to complement one another with the services that you're providing, and you can all pick up similar things that you're doing together. And you don't want them to be your adversaries. You're in this together, and it should be warm and fuzzy and sweet and nice. And I'm that warm and fuzzy, sweet and nice person. Wendy will tell you that. Wendy, who's one of my grantees. But really, I mean, you want to be able to celebrate and build these programs, with joy together, rather than have it be contentious. You don't want to have collaboration meetings when you walk in the room, and you're like about to walk in the room, and you take that deep breath and you think, I just don't want to see that person at the table. You don't want that relationship. That's not what's going to keep your program sustained. That's not what's going to build people who are in the elevator with a congressperson or a politician in your jurisdiction that will say to that person, oh, did you know that XYZ is doing this great thing? I just heard about, some great case that they had with their client, and it was really inspiring, and you should see the effects. You want that person to have that elevator conversation on your behalf. And if you don't have good communication, that person's not going to think about you that way. And you want clear terms of participation about your programs beforehand as well. And this goes back to what I said earlier on about programs that are worth being sustained. You don't want there to be extraneous things that you don't know how they work. So putting together policies and procedures manuals and tightening the ship around your operations, and quality assurance things around your operations. And this all goes into the things that you heard from Anne Marie, that when you're doing data collection and you're demonstrating your outcomes and you're doing evaluation work, you need there to be finite points that you can describe that are fiscally sound and that match financially. You don't want to be having to show people what you're doing and then saying, but we sort of wasted money in this area, and we have we should be getting these referral forms in a better way, and they should be shuttled to my case managers this way, or my referral source or intake, without really knowing what that looks like. If it's really, really messy, why is it messy? And if you don't have a policy around that, there you go. Okay, we're going to speed through the demonstrated outcomes piece. I'm not even going to flip through those slides. In case you didn't know who Hank Stedman was, that's Hank Stedman. I'm going to leave the quote that's up there. We have a couple of other quotes that are in here. That's from our mental health court curriculum. I just want to show it off again. It's very pretty. If you go to the curriculum, you'll actually hear him say this quote along with a bunch of other partners around the country, around the different modules. I'm going to read you a second half of this quote. So he talks about collecting data from the very beginning, and over again, he's worked with projects and talked about, looking at it annually. He goes on to say that it's not just important it's not just important to collect data, but to collect basic data, descriptive data, not fancy data about who's coming in, where they come from, how long it takes you to do evaluations, who gets accepted into your court and your programs, how many people get accepted and tracked in terms of how long they stay under supervision, and that when courts don't do this and programs don't do this, it's mistakes. And there's a whole long other list of different data elements that you can collect. And we have actually, CSG has done a couple of webinars on specific data collection. If you weren't satisfied with Anne-Marie's presentation and you would like some more and you would like some actual points, we have a couple of print publications that are on your thumb drives that are on data collection for mental health courts and building mental health courts that actually have a page with, 75 different elements that you should be collecting. And then we have a couple of webinars that we back that up with. So if you need that list again, it's there. And that's probably about all I'm going to really talk about data for today, because I think you guys sat through that plenary and it's probably enough for you guys.
I have a quick question on data. I know a lot of that was geared toward, I think, adult pieces. What difference would it make collecting data from juveniles? Or are there different emphases?
Okay, so that's a good question for me, because I manage the juvenile cohort of grantees for JMHCP, so all the juvenile programs are mine. So with the programs that I work with, pretty much a lot of it is the same. So a lot of the core things that you're collecting are the same. And where you depart on the juvenile side is where you depart on the juvenile side with everything. So you are capturing more information about family, and specifically, depending on how into family you want to get. And I would encourage this, things like how many siblings there are, if there's other mental illness or drug use that are within the family, if families are employed, whether or not they have transportation barriers, if you're dealing with a family of origin, as in a biological parent, if you're dealing with a caregiver, if you're dealing with a youth that has gone through foster care or is in the child welfare system in some kind of other capacity. So a lot of those elements. And then I always take a deep breath before I say it, school involvement. Because if you're a juvenile grantee in this room, or you're familiar at all with juveniles, you know that it's very hard to get schools to the table. And you know that they're not always a very strong player. So how a youth is doing in school, if they've had suspensions, if they've been expelled, those kinds of things. And if you want to go through some of those specific elements with me afterwards, because I know I just rattled them off really quickly, I'd be more than happy to, talk through some of that stuff. The other slides that I just went past really quickly were about performance measurement and program evaluation. One last point about it, 2 points. If you were a mental health court, if you're a court partner in this room, the National Center for State Courts has a document and a webinar all on performance measures just for courts. If you're interested in that, there's not actually a link in this, so when it's posted, you'll have to come and find me. You can actually even Google it, National Center for State Courts Performance Measurement. It will come up. It's a whole roadmap. We actually worked with them on putting those together. And one last thing about data. I have a grantee that's in Utah. They're an expansion grant. I love them. We went and did a site visit there. Okay, I love all of you guys. Who am I kidding? They're an expansion grant. They've been doing their work for a number of years, and I've been in contact with them post-grant, and they've been applying for funding at the state level, at the county level also. And Darren went and he had 2 meetings, 3 meetings. I kept getting emails from him about the meeting went really well. It was really good. We have all these great outcomes. We lowered the amount of school absences. We lowered the substance abuse. We lowered mental health. There's off the charts family engagement that we've done, and relationships with social peer stuff is off the charts now, higher. We have showing them the best outcomes. And I'm really looking forward to like getting this small grant from the county. And then I got another email from him and he said, Cynthia, I'm so disappointed. After this meeting, I had these beautiful slide presentation. And then I told them, they like were blank-faced with me. They were just staring at me. They had no reaction. And then I told them a story about one of our clients, this girl who went through the program. Gangbusters, really horrible story. She's doing amazing. She's back in school. And that's what they bought. That's what they wanted to hear. And I'm so frustrated by that because it's our outcomes. Don't they want to know about the outcomes? So yeah, they want to know about the outcomes because they want to put that in the little blurbs. But to get them there, they want to hear about the people. So don't underestimate the fact that you want to tell success stories of real people. Well, I'm going to repeat that again in the marketing piece, but real people actually, a face, pictures, even people that can, come to your meetings. Funding, aren't you happy we got here? What time is it? It's 11:30. This is the section you guys want. Look, it's show me the money again. He looks so desperate. Okay, so these bullet points come from that first reference that I had put earlier on. And essentially, you know how I asked you about, showed you that worksheet and about the things that you should be asking questions about in terms of the funding. You need to sit down and figure out what you actually want to have funded and what the potential funding sources are, meaning in your local community, faith-based organizations, county level, block grants, state level, federal level. And have you developed some kind of a layout or strategy around how you want to do that? And I hate to say this, but dedicating a person in your agency whose responsibility is to do some of that legwork, and we have a quote later on about that legwork, about how this is really, really hard work. This is where things start to get a little repetitive here in the marketing stuff. One of the things that you need to think about is whether or not any of your collaborations or stakeholder collaborations or internally, if there are places that you overlap functions that you can incorporate under one umbrella. And if there are things like reordering certain workloads, if you're in community corrections, for example, and you're in probation, have you sorted out your mental health clients, for example, your high risk and your high need clients, going back to everything else you've heard about R&R in the last couple of days under one probation supervisor? Or given them a mixed caseload so that some person has a dedicated mental health capacity so you don't have other supervision folks spinning their wheels trying to figure out how to work with somebody who's mentally ill that they've never looked at before. So maximizing your actual resources that you have. Your evaluator is actually, if you have an evaluator in your program, it's actually a really good person to work with around this. As far as funding and also in marketing, I'm going to get to the marketing piece and have nothing to tell you guys. But as far as marketing, one of the other things that's very good, and I know that program that I worked with, and then also a lot of jurisdictions that I've worked with, if you have a local university, it's a great way to have students come in and do short evaluations of your program or take a look at some of your data and get some free research and free publications about your program. Students across the country are looking for real data and real people to work with, and that's a really great way for you to utilize them, and it's a win-win situation there. They get access to your program and your clients and looking at your operations, and then hopefully you get a publication about it, and then you get that publication about it, and then you can tell everybody with your publication in hand, look, people talked about us. Okay, and I think I've gone through a lot of these. These are some of the questions that I'm specifically asking, like about community corrections. Does each agency or organization fund its own staff members, for example? Does the court specifically support the judge's time? Who's going to pay for a boundary spanner? So the people who have feet in all different places. So somebody who's under the authority of multiple systems or multiple agencies, for example. If you have a peer specialist who they're going to be paid for, and I don't have to read you everything that's on that slide. I was at a meeting in Colorado last year, and Colorado has something called a Criminal Justice Coordinating Council in a lot of the jurisdictions. So it's a very large stakeholder group that has all the different partners, so judges, public defender, state's attorney, mental health, local sheriff's departments, and all of that stuff. We were talking about the mental health program and a case manager that they hired under this grant. And the DA had never come to the meeting before, the actual DA. ADAs had come. And the mental health partner was really cranky because they kept asking for the DA to come, and the DA kept not coming. We had some very good leverage there because some of the partners, and I drill this home to our grantees, we're not actually the federal government, but sometimes it's helpful when we do a site visit for our stakeholders to think that we're the federal government because they'll come to the room if they think that we are BJA, but we're not, and we don't ever represent ourselves. I think that Keisha was back there a second ago as BJA, but it's a good leveraging source. So the DA comes to the meeting, and there's this case manager piece is being paid for by multiple, or is under the mental health agency, but they wanted it to be paid for by multiple agencies because the case manager is screening some of the people pre-arraignment. These are the pieces that I get always confused. But she's working in all these different points of the system, and she's saving attorneys time from doing work that they had been doing before. So that became very, very clear at the meeting, and he said, not me, he said, he's looking around the room and he says, so she does screening for us, and she does screening for the public defender, and she does screening for the court and the mental health agency, and that's 4 partners, and what's her salary? You know, I think we can figure out between all of us like 10 grand to pay her salary, couldn't we? So the mental health agency just forgot about $30,000. It's gone because 3 other partners agreed to pick up a case manager's salary between all of them that they did at this meeting. And then he came to me afterwards and he said, I'm so sorry we haven't come to this meeting before. I'll make sure that I come in the future. And that's brilliant. And that's a way for him to get emotionally invested. And that's where it works. More questions? And don't underestimate, as Judge Tamara Curry, look, Judge, can tell you about in-kind services. There's a nice quote from the mental health court curriculum. We'll summarize it for you about in-kind services. Beds in your shelter, other work that your public defender's office can do. Victim advocates. There's a very rich consumer victim advocates across the country. Unfortunately, there's a session on NAMI that's happening right now that you guys are not in. That's all about utilizing the different consumer advocacy agencies across the country that can help support your families of your clients, not necessarily on the juvenile side, on the adult side as well, as being supportive, and Veterans Affairs offices. It's going to be up on the website. Our website. There will be a conference website at the end, and during this time, I'm blanking on the name of the session. I can tell you who the speakers are. Laura Usher for NAMI, who is the criminal justice advisory person for NAMI. She actually has a listserv off of NAMI's website. Oh, and for those of you, I'm sorry, I'm throwing out an acronym without defining it. I'm assuming everyone here knows who NAMI is, but NAMI is the National Alliance on Mental Illness, and they're one of the largest grassroots family-run advocacy organizations in the country. Not every jurisdiction around the country has a NAMI chapter. Mental Health America is also in a lot of jurisdictions, MHA. They're a similar organization. They tend to be in a lot more rural communities. And then on the child side, Federation of Families is another advocacy organization that does that work as well. It's Laura Usher and Colonel Kim Ward are the speakers of that session that are happening right now. And then just a shameless plug for you guys, along those lines as well, we did a webinar that is probably one of my favorites just a couple of weeks ago if you work on the juvenile side. Although I want to say that it's almost applicable to families in general on family engagement. That happened 2 or 3 weeks ago, I think. We had over 500 people attend the webinar, and we did archive it. It's on our website. We had an overwhelming number of questions. I really feel I moderated it, so, shameless plug. I feel like it was one of the most successful ones that we've done. I've moderated a whole lot of other webinars before, but it's about family engagement, and there's some practical tools and strategies around it. And it's archived on our website. It'll bring you to a YouTube channel, and in the last 2 weeks, it already has another 50 views. So that speaker is here also right now doing a follow-up to that, and her presentation will be available online. Wendy Luckenbill.
So I'm not going to go through each one of these categories, but I will, in a summary fashion, say very often state-level funding can be easier to access if the state knows you need the money. And specifically, there's 3 programs that I'll talk about. One of them is which is through your Department of Mental Health, would be SAMHSA block grant funding. This is very nice money if you can get it, because it's 100% state funded. You don't have to worry about whether people getting reimbursement through Medicaid. It's to fund gaps in programs around the country. And a lot of states are, through their block grant, are funding diversion items, diversion programs. They see it as a valuable thing to do because it reduces emergency room use and because it reduces hospitalizations. They like that. On the other hand, there's also SAMHSA provides to your state PATH dollars, Program for Assistance for Transition from Homelessness. PATH dollars. Each mental health department gets these. They go to agencies in your community. There's a website that will tell you which of those agencies in your community get PATH dollars. PATH dollars are it's very nice money, because if you can get some of those dollars, again, they're to prevent or to reduce homelessness. And it comes with some small amounts of cash dollars to help people fix up an apartment, for example, if they need that to make the housing livable. It's very flexible money. And again, some of the programs use this money to enhance the services to the people that they're working with. So there's the PATH dollars and block. Find out who the people are in your state that manage those programs. The other pot of money, which is very nice, is the justice money that comes into the state through the Burn Grant program. How many use Burn Grant dollars in their programs already? Very nice dollars. There's not necessarily an end to burn grants. They'll go on for several years in some cases. But again, a lot of states don't really focus on providing. They might do drug court stuff and typical drug court programming, but if they're educated and they're part of the process, they will use some of their money for mental health programs. In New York, we actually, the parole had some leftover burn grant dollars and came to OMH, us, and said, we want to do a housing program in New York City for persons with serious mental illness. So what we did, our agency then says, well, you know what, we'll match your $500,000 or your $250,000, and we'll fund an ACT team. So now we got a housing program and an ACT team with burn grant money and block grant dollars. It was very nice. So BYRNE. If part of your getting one of developing a 501c3 capacity that's attached to your program is very good at enhancing programs. It won't necessarily sustain your funding, but it will help you enhance programs. And I think we've dealt with many of these other issues. Just a quick word about, I'm going to talk about Medicaid expansion in a minute, but the SOAR program, Social Security Outreach, Access, and Recovery, people know how many people don't know what that is? Okay, so basically it's a training program to train case managers on how to submit a Social Security application and get approved the first time. Nationally, the rates of approval for a first application are 23%. After the SOAR training, it's 90%. It makes a huge difference in terms of if you get your Social Security application approved quickly to get access to housing programs, get your services that you're providing reimbursed. So PRA is the SOAR Technical Assistance Center. If you want more information about it, visit our website or contact me, and we can bring some training, or there may already be training in your community, but the jails or prisons might be excluded from it. We can work to get it included. So overall, these supplemental funding strategies, they provide funds for, they do 5 things. They provide funds for sustainability. They provide bridging services between institution and community until Medicaid and other benefits can be obtained. They can broaden the target population, expanding diagnostic or functional categories. And they supplement existing community services where there are capacity issues, and then they pay for services not available for Medicaid or health insurance. So it's really more than sustainability. You're looking at enriching your programs and even expanding the populations that you serve very often. These are a whole list of agency and grant programs which you can go through at your leisure, and they'll be available up on the website. The only other program other group to look at is some of the pharmaceutical companies have a philanthropic branch, and they will provide grants for diversion kinds of programs and other kinds of enriching programs also, certainly a lot of training programs. So don't exclude them. It's good. Lilly is one that I'm aware of. Janssen is another. AstraZeneca is another. So, and again, you can. Are there anything special you want to say about these grant programs? Again, these are the sources to look for. How many are familiar with the Affordable Care Act? How many justice professionals are in here? Okay, so I think most people who work in the mental health field understand the Affordable Care Act and what some of the advantages are going to be. But for a lot of justice professionals, as this is starting to roll out, and states are getting busy about this, right? Getting their planning programs, developing how people are going to be made Medicaid eligible, developing their service packages. The justice population, people coming out of jails, people under probation, parole supervision, people who are in crisis kinds of situations, do not want to be left out of the planning on this. Because, and aside from expanding Medicaid coverage to basically people who are at or below 133% of the poverty level, they define, there's an inmate exclusion as there is now, but they changed the definition. An incarcerated individual excluded, and an individual shall not be treated as a qualified individual if at the time of enrollment the individual is incarcerated. And this is the key. Other than incarceration pending the disposition of charges. Now, in any jail, 20% of your population is sentenced and ineligible for Medicaid. 80% are. So what raises the issue there is how are jails going to gear up to ensure that people, that this pretrial population gets enrolled in a timely way. It's not an easy discussion, and you need to be at the table now for planning for those issues. So contact your local county health commissioners, contact your your state level county health departments, and again, if you've got a judge that's a partner in this, you'll get the attention of those folks more easily, and to begin planning for this. So I just want to do these last 3 slides, and this is the marketing piece of it. So as you're marketing, you got to sell this program to people, right? You got to sell your program and say why it works, and certainly data is important. But there's 3 things that you're selling. One is you're selling needs. So you want to look at let people know what the prevalence is. People with mental illness are disproportionately involved in the justice system. That, as Al Franken said in the opening ceremony, that's morally wrong. We need to do something about that. So there's a moral argument. Next slide. There's a cost argument. More justice-involved persons with mental illness do not have health coverage in the first place. And again, they overutilize high-need services. There's a public safety issue. And this is just some studies that you can reference about how jail diversion is a safe thing to do. There's a number of studies besides these that show that these programs reduce public safety risk and get people involved in programs. So you have to think of your marketing strategy and your message, and these are some ideas for that. There's also the expand benefits and save paradox. A number of studies are showing that as Medicaid has been expanded to substance abuse populations, their health outcomes improve, their behavioral health outcomes improve, they stop using substances, which is a huge risk factor for criminal justice, And they're arrest and incarceration rates go down by expanding benefits, okay? You're actually saving money. So people need to understand these dynamics and the economics of this. And I won't go through that. And Judge Artemis talks about the importance of building relationships in this quote. I won't read it right now so that we're done.